Welcome firstly to all of you to this interactive workshop to introduce you to our serial prescription toolkit, and just to remind you all that this session is being recorded. It's really encouraging to see so many of you joining us today. Excuse me, we have over 140 people registered for this workshop and over 500 people across the series of 4. And we are aware of the sustained level of pressure being experienced by your teams. So we'd like to take this opportunity to note our appreciation and thank you all for investing your time in joining us today. Can we have the next slide, please? So we'll start with a quick introduction of the presenters for this session. My name's Eloise Johnston. I'm the Senior Improvement Advisor who will be leading these digital workshops to help you implement serial prescriptions in your practices. We're joined by Dr. Graham Gould, who is our GP clinical lead, and Adeline Tan, our Improvement Advisor. Many of you will know Leslie McFarlane, who was the Senior Improvement Advisor leading the Pharmacotherapy Collaborative, both before and during the pandemic. She's now moved on to a promoted post within Healthcare Improvement Scotland in Excellence in Care, so we send her our team congratulations. We're also delighted and very grateful today to be joined by Elaine Payton, Margaret Robertson and Caroline Galt on the workshop with us today. Elaine is NHS Greater Glasgow and Clyde Senior Prescribing Advisor, and Margaret and Caroline are the Chair and Deputy Chair of the National Community Pharmacy eHealth Facilitators Group. They will be on hand to respond to queries via the chat box as we go along. And for now, I'm going to hand over to Adeline.
Next slide, please. Hi, before we start, I'd like to run through some basic virtual housekeeping to ensure you get the most from this experience. To minimize noise interference and maintain streaming quality during the session, we have muted your microphones and turned off your cameras when listening to the presentation. We will be recording this workshop and it will be posted on our pharmacotherapy website. We will email you to let you know once this is posted. We have set time during this session at different points to pause for you to ask questions and for us to answer. You're invited to interact with us during these pause sessions by raising your virtual hand and unmuting your microphone. Please feel free to turn on your camera if you wish. We invite you to use the chat box to ask questions throughout the workshop as well, and you should find the chat icon at the top of your screen. We have recorded the Serial Prescription Toolkit webinar and will be publishing it shortly on the pharmacotherapy website. We will be adding to the resource from these series of digital workshops, and an update will be available towards the end of January and will be circulated soon after. If you are experiencing any technical issues, please let us know in the chat box so that we can help you resolve it. Finally, please note that any text in the chat box and any video and verbal communication are recorded and will not be published on our pharmacotherapy website. Next slide, please. The aim of this session is to provide you with a demonstration of the toolkit's functionality, an explanation of how to assess and apply the practical resources within the toolkit, as well as an opportunity to ask questions and share experiences of setting up or reviewing of serial prescription processes. We are discussing Step 2 and Step 4 today, and our workshop's target audience today are the GPs, primary care pharmacy teams, practice managers, and other primary care prescribers. Whether you are from one of these groups or play a different role, you're all very welcome today. Next slide, please. We'd like to learn a little bit more about all of you. And if you can, please pop in the chat box your name, where you are in the country, and if you have joined our Serial Prescription Toolkit webinars in October or our first digital workshop last week. Please also tell us your expectations for joining this session today. And I'm going to keep talking while you do that. You can see on the slide today that we have got a heat map that shows the stars on the map show us the spread of attendees from the introductory webinars in October. I'm going to pass you over to Eloise now.
Thanks, Adeline. Can I have the next slide, please? So thanks for your participation so far, and see some responses popping into the chat box. It's actually really helpful for our planning to understand particularly where you're joining from. So while your notes are popping into the chat box, I'd like to take a really brief pause here to set out our intention for the atmosphere that we'd like to create in today's workshop. So we do know from lots of collaborative work with primary care teams over a number of years that someone in the room usually has the answer. And despite today being a virtual room, our role today very much is to present the resources to you, and perhaps more importantly, provide you with an opportunity to ask questions that will help you to plan and implement serial prescriptions. So as Adeline said, this is the second of a series of 4 workshops. Our focus today is on the selecting patient stage. We'll be taking you through the toolkit to show you more of the detail. And whilst we won't have time to open every individual document, we will explain how the toolkit's structured, and we'll try and highlight all the resources that are included within it. Next slide, please. So this slide shows a really helpful document that's hosted on Scottish Government's website, which sets out what the Medicines Care and Review Service means for patients. And it describes serial prescriptions as pharmacies working with GP practices to help people get their medicines at the best time for them. If people are prescribed regular repeat medicines, they may be able to have a serial prescription if their prescriber thinks it's suitable. A serial prescription can be issued for 24, 48, or 56 weeks and will be kept by the community pharmacist, who will dispense it in regular intervals as prescribed. This means that people can get their repeat medicines straight from the pharmacy without having to order prescriptions from their doctor beforehand. When transferring to serial prescriptions, it's essential that you test your processes to ensure they're safe and improve quality for the practice and the patient. And some of the benefits of using serial prescriptions are that it can be more convenient for patients, it can reduce some of the unnecessary footfall and phone calls to the practice, there's potential for it to reduce the sort of administrative workload within the practice, and it can really support our colleagues in community pharmacy in coordinating and managing their workload in a more predictable way. Next slide, please. So we initially started work on the Pharmacotherapy Collaborative at the end of 2019, and when it was remobilised after the first lockdown, the feedback was that a focus on the implementation of serial prescriptions would be the most useful thing for us to prioritise. So between November 2020 and March 2021, we worked with 53 GP practices across 8 health and social care partnerships in Scotland to develop and test new and existing practical guidance and resources. The resulting toolkit that you see on the screen is a combination of national MCR, some co-produced iHub, and some local resources that teams have shared with us. So we're absolutely delighted that we've had the toolkit endorsed by the RPS, and we're currently working through that process with our CGP as well. The toolkit's been designed as an interactive PDF and designed as a cycle of 5 key steps: planning for serial prescription processes in your practice, selecting your patient, setting up your serial prescription processes, discussing serial prescriptions with your patients, and start dispensing serial prescriptions. At the centre of the implementation, you'll see the quality improvement or QI tools that support these processes. And it won't come as a surprise to anyone on the session today that practices will all have degrees of variation within serial prescription processes and experiences. The toolkit's designed so that you can click onto the icon of the steps that you want to review. And the toolkit consists of just 9 slides in total. And you can scroll through or click on any of the icons highlighted in red, which take you directly to a specific page with a range of resources. Next slide, please. This is what the page of resources for each of those steps looks like. And we've used the stage of setting up a serial prescription page just as an example. The page is divided into purpose and resources. In each purpose, the resources have been categorized into whether they're guidance, a tool, or a training resource, and each one has an icon to denote its category. Where you see something in bold text, this denotes a key document. And some steps also have additional sections on good practice resources. And at any time you want to return to the front page of the toolkit, you just click on the home icon at the bottom of the page. So at this point, I'm going to hand over to Dr. Graham Gould, who's going to take us through the stage of selecting patients. Over to you, Graham.
Thanks, Eloise, and welcome again to everyone who's attending today and those of you who are returning from our previous workshops and webinars. So today we're going to talk about how to select patients. The first point in this step of the toolkit is to look at how to set up the processes you can put in place to select suitable patients. This is a crucial step in implementing serial prescriptions successfully, because not every prescription can be produced as a serial prescription, and not every patient is eligible for this service. This initial stage is about using the knowledge and experience of your team to identify potential cohorts or groups of patients that may or may not be appropriate for serial prescriptions. As a practice team, it will be helpful to produce a practice protocol and to document your agreed inclusion and exclusion criteria within the shared care agreement. There are examples of how to do a shared care agreement provided within the toolkit, and we mentioned those in the previous workshop. Some exclusions are set by statute, such as Schedule 2, 3, and 4 controlled drugs, but others may be more flexible and subject to change over time as your expertise within serial prescribing improves. For example, with when required medicines or as required medicines. So your initial exclusions may change as you become more comfortable with the service and you see opportunities to extend it and maximize the benefits to the practice. This slide shows the inclusion-exclusion criteria developed by NHS Highland, and this may help you to get started with your initial discussions. Please note, this is a locally developed example. It's important to be aware that exclusions can vary from board to board and that you agree this for yourselves. Next slide, please. So we're going to pause here just to ask if anybody's got any questions or insights on what they did to share on establishing criteria for serial prescribing.
So we have got a question asking if there will be no Dorset patients for serial prescription.
I'll
Thanks.
take that one, Adeline.
Yeah.
If that's cool.
Yeah, on you go. Thank you.
If that's okay, Graham.
Yeah.
Technically, Dosette patients can be included in this process because you would just mark them as weekly dispensed, and that's one of the options when you're generating a serial prescription. However, the problem comes in the community pharmacy that because the patient moves on to a serial prescription, they cannot make up the tray as far as in advance as what they would do at the moment, so that they're maybe working a kind of week in advance to when the patient gets it, and actually the serial prescription reduces that. So it actually makes it very difficult for the community pharmacy to manage a Dosette box on a serial script, though technically it is possible. Practically it doesn't work too well, and we haven't quite got to the bottom of that yet. It's still on my to-do list, but I haven't quite got a solution.
Thanks, Lynn. Anything else, Adeline?
No, nothing so far.
Okay, so maybe we should ask our attendees how they might involve their team in agreeing how they would come up with their own inclusion-exclusion criteria, and if they could put that in the chat box or come back to us with a raised hand just now, that would be fine. Otherwise, we'll move on to the next slide. So once you've agreed your inclusion and exclusion criteria, the next stage is to identify potential patients. You will essentially be creating a cohort of potential patients so that you can apply your previously agreed inclusion and exclusion criteria from your shared care agreement to identify which individual patients are suitable for a serial prescription. There is benefit in putting processes in place to regularly identify, review and change suitable patients from repeat prescribing to serial prescriptions. Potential patients can be identified in a number of ways. For example, a database search, or during a consultation, when repeats have been requested, or by a practice team member highlighting a potential patient. Local community pharmacies may provide another useful source of information on suitable patients. The Scottish Therapeutics Utility uses the STEW software, and this is a highly recommended and useful way of providing searches of your patient database to establish a cohort of potentially suitable patients. Don't worry, the toolkit contains both the installation and user guide for STEW. Next slide, please. The two key documents shown here are SRO1 and SRO4, and these describe how to run a search for suitable patients in EMIS, that's SRO1, or Vision, SRO4. And these are specific pieces of guidance and tools for Vision and EMIS practices, respectively, to assist in identifying suitable patients. As described earlier, one of the ways patients can be identified is by running a serial prescribing database tool. Thinking of EMIS first, the data within the tool is based on an extraction from EMIS and relates to the previous day or earlier data within the practice. Any work undertaken on the day will not appear or impact upon the database results until the following day. When refreshing the information, the tool has a large number of complex searches to run in order to generate the information. This means that a refresh can take 10 to 15 minutes to run in a larger GP practice. Within Vision, there are two ways of flagging patients as potentially suitable for a serial prescription. Just to highlight that the document still refers to CMS, which is a slightly outdated reference, but the processes are the same. You can use the Populate CMS Suitability tool, and you can mark individual patients as suitable for CMS, or in this situation, you'd be marking them as suitable for serial prescription. And you can do that by group populating suitable patients. The Populate CMS Suitability function allows you to mark patients as suitable within a specific patient group. You might want to review your chronic disease registers for patients who are potentially suitable. You might also like to add a reminder to the flagged patients. The best way to do this would be to create the CMS suitability report and save the results to a group so that you can add bulk reminders from patient groups. Flagging individual suitable patients. You can flag suitable patients on an individual patient basis from the patient details and consultation manager or registration suitability of individual patients at any time. Don't forget, you can identify patients who have been highlighted by the community pharmacist. It may be helpful initially to produce a list of patients who are already registered for CMS at their community pharmacy. You can then decide whether or not these patients will be suitable for serial prescription. Next slide, please. Document SRO5 is producing a serial prescription in Vision. This was produced in partnership with NHS Grampian and NHS Fife and will provide some practical help for practices using Vision. The document includes guidance on a number of stages. For today's workshop, it's helpful to know that the first three sections relate directly to marking patients as suitable or unsuitable for serial prescription, identifying MCR or CMS registered patients, and identifying unregistered patients suitable for serial prescription. So at this point, we'd like to pause again and see if anyone has any questions or stories to share on establishing criteria and identifying potential patients.
So we've got somebody who said that they do birthday month chronic disease medication annual reviews, and once these patients have been added and had all their bloods and blood pressure checks, they'll look at changing them over if they're suitable. We also have somebody who said that the admin staff in the practice identify them as they're printing the repeat request and pop the patient name in the pharmacy column if they look like they might be suitable. But we do have Margaret who's coming in to say that it's important you ensure that you don't overwhelm your pharmacies with too many patients in 1 week. Agree a suitable number via your shared care agreement.
Yeah, that's a good point from Margaret, how to stagger the introduction of serial prescriptions. It's important not to overwhelm the pharmacy, but also to remember that you're going to have to review these patients probably in a year's time and look at their prescriptions again. So don't do them in too many bulk moments. And the two comments you had about processes used, absolutely, that's exactly what we did in our practice. We've been using month of birthday review for many years, and that is how we run our long-term conditions or chronic conditions reviews. And absolutely right, once the staff and the team are comfortable with both the processes and the identification of suitable patients, that's a great way of highlighting it both to the pharmacy team and or the GPs that are involved.
We also have another participant who said that they have the local community pharmacy who identify patients at their end and then alerting the GP practices as well.
Yeah, that's good to hear, Adeline, that what we've suggested in the slides are processes that are actually working and are happening on the ground. Okay, let's move on. Next slide, please. Having identified your suitable patients, whether from a database search, during a consultation, or when repeats have been requested or highlighted by a community pharmacy team or your practice team member, they must now be screened for suitability, clinically reviewed, and the details forwarded to the appropriate staff for creation of a serial prescription. You will need to consider the following. At least a level 1 medication review must be undertaken on any patient deemed suitable for serial prescription. Also consider whether you will set a maximum number of repeat items that will be considered initially for new patients. And also, as previously mentioned, whether you will include as required or when required medications on serial prescription. The toolkit also contains a screening tool for EMIS and Vision, which requires a SWAN token for access. These documents have been shared so that they can be accessed wherever you are based. However, if you're experiencing any difficulties in using them, please get in touch with us so that we can investigate and link you to the appropriate expertise. That might be your own IT facilitators within your health board. As a good practice tip, it is possible that changes in processes may negatively impact on people with specific needs or protected characteristics. So this should be taken into consideration as you design your processes and identify your patients so that you can take steps to mitigate any potential negative impact on specific groups. And again, at this point, we'd just like to pause and ask if anyone has any questions or stories to share around screening or clinically reviewing patients before we hand over to Eloise.
So no questions has come in for this section, but we have one participant commenting that the serial prescription toolkit or serial prescription process only works and benefits practices if a large number of patients are enrolled to serial prescription? Would you or Elaine like to respond to that?
Yeah, I would agree that there's likely to be a tipping point, and one way of measuring where you are with your amount of serial prescriptions is to look at your Scottish Therapeutics Utility or STEW tool, and that will tell you how many of your repeat prescriptions have been converted to serial prescription. And certain health boards across Scotland have found that you probably need to be in a double figure of percentage to get the benefits of serial prescription coming through on your prescribing processes. So in some areas they found it was 10%, in some areas they found that they probably needed to have 15 or more percent to get the real benefits from serial prescription. Any further thoughts on that, Elaine?
No, I tend to agree, Graham, with what you've said there. I know that the GP's come back, said that he feels there's too many restrictions and exclusions. I think there's a little bit of there's really only kind of two exclusions around the controlled drugs that you mentioned in cytotoxics, but beyond that it's about just kind of working in partnership with the practice and the patients and the pharmacies, and I think it does become easier once you become familiar with it. But yeah, certainly historically what we've seen is 10% of your patient list before the practice notices a workload difference. Is true, yeah.
And you're absolutely right, Elaine. You need to have a certain amount of scale within the process so that the prescribers can become comfortable with what to do with renewing prescriptions, reviewing treatment summary reports. None of these are what we're talking about today, but you do need a certain amount of volume of dealing with these scenarios so that you become comfortable with them when they come back in bulk. Okay. If there's no more questions at this stage, we'll move on and pass on to Eloise. Thank you.
Thanks, Graham. So we're going to move on now to look a bit more closely at communication. And if you attended our first workshop, you'll note that we are going to be covering the same resources. This is for the benefit of those attending today for the first time. However, hopefully there'll still be an opportunity for you to learn something from the discussion and maybe some of the questions that come up. So clear and effective communication with patients is going to be key to that efficient transfer from repeat to serial prescribing. And when undertaking a move to using serial prescriptions, it's really helpful to consider at the earliest stage possible how you're going to discuss with and inform your patients of any changes. You and your teams know your patients best, and good practice is very much to get that team consensus on what your communication strategy is going to be. And you can agree that in your shared care agreement before you start the processes of selecting and screening your patients. And in terms of personal learning, I think there is always something to learn. So having written the scripts for these workshops, I certainly have learned this week that it's possible to create a serial prescription for a patient who hasn't yet registered with the pharmacy, which I didn't know if they're considered suitable. So it is possibly the case that you can make your patient aware of this option, either through a conversation with the practice staff or by attaching a note to their prescription, which informs them that when they present their prescription to the community pharmacy, they'll be asked or required then to register for MCR, and they'll need to collect any further issues of that medication from that same pharmacy. So I could say that there's possibly always a little detail that you might learn, even though we're looking at the same resources again. So can I have the next slide, please? So what we're going to be looking at here is about how to have those person-centered discussions with patients. And it is really important that our discussions with patients are person-centered around this, because there is potential that it becomes framed as more of a process-centered conversation. And obviously the key element of this is around how serial prescriptions can really benefit your patient. And there's a document within the toolkit called Questions to Prompt a Person-Centered Discussion. And it's a key document to support you with these initial discussions. And it can also be helpful at a review stage, particularly at that first review. Next slide, please. So the other key document to help you with those discussions and at the review stages is the person-centered discussion checklist, which again is one of those sort of practical resources that have been developed that you can have a look at, and you may need to review it so that it suits your local processes and systems, but it's there really just to get you started thinking about what's involved. Next slide, please. So we're just going to take a brief pause here. I know there's a couple of points that have come into the chat box, maybe about things that we've covered earlier on in the session, so we'll see if we can pick those up. But also, if anyone's got any questions around the sort of points of discussion with the patient and how you would have those conversations, or possibly patients where you've had that discussion, if there's any feedback or learning that you could share with the group.
So not really a question, but more of a remark around many patients have cognitive impairment or dementia, and meaningful discussions with these patients will be minimal. I don't know if you want to come in and address that.
So I guess, Adeline, that takes us back to where we talked earlier in Graham's section around particular groups or cohorts of patients that might experience a negative impact because of certain characteristics. And it's actually how you consider that patient holistically in terms of what other information beyond the clinical information you have about that patient that denotes whether they'd be suitable or not for a serial prescription in the first place, and thinking about whether they have support with their medication and whether it's a conversation with potentially a carer or another patient advocate. And I think it is one of these where it's very much a judgment call, and we're not here to prescribe how you have that conversation, but just to signpost you to a couple of the documents that teams have used locally to be able to start thinking about how they would do that for themselves. And I agree, there will be some patients where that necessarily isn't the right option, and we'll go on in the next couple of slides to talk about alternative methods of communication with patients. So we can have the next slide, please. So this second point does cover written communication to patients. So an example that's been shared within the toolkit is a patient information letter, or possibly a leaflet, for informing patients of the basic changes to the system. So the written communication can also offer some reassurance around areas of their care which are unchanged, but might be of concern, such as their ability to see their GP. Can I have the next slide, please? So here we have an example of a locally developed patient information letter that was developed by NHS Highland. And at this point, we're just going to take another quick pause to see if anyone's had any experience of using letters to share or leaflets, maybe notes stapled to scripts. If people would like to maybe pop comments in the chat box about what's worked for them locally or what they think they might be trying. So either I've lost my sound and connection or it's all gone very quiet.
And we've got somebody who said that the practice sends consent letters and they can be returned to the surgery or community pharmacy. Early days in their work, but it's working well. And somebody has put in the chat box that they use letters, but there is something to think about in terms of the cost and environmental factors with that. And they're not sure how they can get around that.
Yeah, absolutely. And I think that's definitely an issue that around practice communication, generally using the mail system. And it is certainly something that we'll need to consider how we can do what we can electronically in terms of information on practice websites, maybe that kind of way of sharing information. So I just saw that, Adeline, about about patients having telephone calls and letters. So some practices have done that, Alison, and I think it's probably one of those decisions where you have to think about particular patients. as to whether there's a benefit to a phone call. I'm not sure that anyone has the capacity to phone every patient individually, but I think some of them, the feedback seems to be that some patients benefit more from telephone calls and some prefer written information that they can keep hold of as a reminder of the change. And I think we're seeing that probably from what's coming into the chat box, is there's a bit of variation in practice, and I think these are one of the occasions where we would be welcoming that variation, and it's very much taking that patient-centered approach based on what you and your team know about the patient's needs and how you meet them best. So I think if we can have the next slide, please. So obviously toolkits don't work in vacuums, and we're really aware of that, and it is a set of resources that's there to help your practice to implement serial prescribing, and how each practice will use the toolkit is going to differ. So really it's about encouraging you to think about how you build serial prescriptions into your daily practice processes. And as an example that was picked up on earlier, staggering the serial prescriptions for your patients, for example, by birthday month, so that when the time comes to the review, they're not all coming in at the same time. So it's about taking that measured and balanced approach towards your practice's workload. And all of these will hopefully help ensure that it's sustainable in terms of workload in your practice, and obviously the impact on the community pharmacy that Margaret mentioned. So I'm going to hand over to Adeline, who's going to talk you through briefly some of the quality improvement tools that we mentioned earlier.
So there is a suite of QI tools that you can freely access to support implementing your serial prescriptions. We have only highlighted some of the tools today. A driver diagram visually presents a team's theory of how an improvement goal will be achieved. A process map helps the team visualize the serial prescribing process. PDSA stands for Plan, Do, Study, and Act. PDSA cycles are an ideal QI tool that can be used to test an idea by temporarily trialing a change and assessing its impact. A data measurement plan sets out details for each measure proposed for an improvement project, and a data collection template helps you to collect appropriate data for informing your work. The link to NAS QI Zone, where more information on how to use the QI tools are shown in the chat box, and it is also in the serial prescription toolkit. You may have your local QI support team. These specialists can help you understand these QI tools more in depth. The other local specialists you may be able to call on is your local e-health facilitators. They can also help support your implementation of the serial prescription toolkit. I'm going to hand you over to Eloise now.
So this is absolutely almost the finishing line here, and I'm sure you'll be breathing a sigh of relief. So in terms of contact details for us, we'll pop the team inbox email address into the chat box for you, so that if you are experiencing any issues using any of the resources, you can get in touch with us directly, or if you have any follow-up questions that you would like us to address, you can just drop us an email there. We will be taking all of the information from the chat boxes across these 4 sessions with a view to populating a kind of frequently asked questions document that will go up onto our website. It'll sit alongside the recordings of these workshops, and we'll also have the recording of the launch webinars that Leslie delivered with the team back in October. So you'll be able to access all of those resources. From January, they should be available, and we'll send out an email to advise you when they're available. So if we could have the last slide, please. So we really genuinely would like to thank you. We know it's an enormous commitment to make to come out of work time, particularly over a lunch break. We've tried to keep these to 45 minutes so that at least some of you will get to get away from the screen for 5 minutes in a day. We do have a short feedback survey. It's only 4 questions, and given that we've got another 4 or 5 minutes before the session officially finishes, we would be really grateful if you can populate that survey for us. Responses are anonymous, so please feel free to be open. We do take the feedback as a gift, and obviously once you've completed the survey, feel free to log off. In the meantime, it remains for us to thank all of you for your time, and I'd like to thank the behind the scenes team who've kept this whole thing running incredibly smoothly, the There's a number of people working very hard to make sure that all the slides are up and that everyone's queries are responded to. I'm really grateful to them all for their efforts today. And particular thanks go obviously to Graham, our GP clinical lead, to Elaine Payton, and to Margaret and Caroline from the Facilitators National Group. So if you can fill in the survey, that would be super. And we hope to see some of you at workshops 3 and 4. And thanks again for your time. Goodbye.